Hello friends, this is a very interesting topic, multiple pregnancy. At least whenever I see a patient in the clinic with twins or triplets, it sort of gets everybody excited, including the patient. Okay, but also remember multiple pregnancy is fraught with a lot of complications and hence it becomes a very important topic. Although interesting, it is definitely a high risk pregnancy. So what are the keywords? What are the keywords we'll be discussing? The keywords we'll be discussing will be chorionicity, twin peak sign, inverted T sign, and we will cover multiple pregnancy in 3 parts, okay, because it's a long topic, and the 3 parts will include the first part is etiology, risk factors and types, and then we will move on to complications, and then we will move on to management of multiple pregnancy. Now starting with a case scenario, a 33-year-old primary presents to the antenatal OPD. She has conceived following IVF and is now 12 weeks pregnant. She tells you that she has been told she has twin pregnancies. How will you manage her antenatally? Okay, so this is a scenario where we have a woman who has twin pregnancy. She's come to us at 12 weeks. How will we manage her further? So to understand this better, let's move on. So first of all, what are the risk factors, or which women are more prone to developing twin pregnancy? So race has been found to be an important factor, and it definitely has a genetic predisposition. Some common races which are found to have multiple pregnancies are in Nigeria. There is a higher incidence of twin pregnancy, and that is attributed to race. Okay, and it has been found that FSH values in these women are on the higher side. So with higher FSH, more number of follicles are recruited and 2 or more ova may be released in a single menstrual cycle, and hence that could be a possible reason. Heredity is also an important cause. If the mother is 1/twin, so if the mother herself is a twin, the chance of her having a twin pregnancy is definitely increased. Same with the father being 1/twin. Okay, a higher parity, multiparous women are at increased risk of twin pregnancy. Increasing age again is a risk factor for twin pregnancy. This is again to do with a higher FSH level. Then very important is iatrogenic. Okay, that means treatments for infertility, not only artificial reproductive techniques but simple things like ovulation induction can lead to twin pregnancy. Okay, ART basically means in vitro fertilization or ICSI. So basically what happens is when we do IVF, we may implant 2 or maybe even 3 embryos inside the uterine cavity in the hope that at least one will take up. Okay, so this leads to an increased incidence of twinning, and this is very important to understand because in recent years this has become very common. Now the incidence of twins, again, this is an important and quite interesting to remember. Okay, so the incidence is governed by something called as Helen's rule. Now Helen's rule says the incidence of twin pregnancy or the incidence of multiple pregnancy is 1 in 80 to the power n minus 1, where n is the number of fetuses. So if it is twins, it is 1 in 80 to the power 2 minus 1 or 1 in 80. If it is triplets, it's 1 in 80 to the power 3 minus 1, that is 1 in 80 square. If it's quadruplets, the incidence is 1 in 80 cube. So this is a rough incidence of twin pregnancy. This was described by Helen, and hence it is called Helen's rule. 1 in 80 to the power n minus 1 is the incidence of multiple pregnancies. Okay, and this is a rough estimate though, but with the increasing ART and infertility treatments, this incidence now has become even higher. Okay, compared to 1 in 80, it is now even higher. Now if you see this chart, this is actually of the United States. I didn't find similar data for our country, but I'm sure it would be very similar. Okay, so you can see this blue line is actually the long time average twin rate. If nothing was done, if infertility procedures were not started, this is the average rate of twinning. Okay, this blue line. But what has happened, and once infertility treatment started in the late 80s, 90s and now very common, is the increased twin rate over and above the average twin rate. So you can see that the incidence has very obviously increased instance of twin pregnancies, and hence it becomes an important topic, and hence we see more twinning, more triplets, which were at least triplets, quadruplets were rarely seen earlier, but now they are also increasingly being seen. So now important is classification of twin pregnancy. So there are two main types of twin pregnancy. One is monozygotic and one is dizygotic. So what actually happens in monozygotic twinning is that there is one ova which is fused by one sperm, and this forms the embryo. Okay, now this embryo splits and forms two embryos. So this is called monozygotic twinning. This is monozygotic twinning. Okay, what is dizygotic twinning? Dizygotic twinning, you have two ova being formed in a single menstrual cycle, and this could be because of high FSH levels, or it could be because of infertility treatments like ovulation induction. So what happens? Two ova meet two sperm and form two separate embryos, and this is called as dizygotic twinning. Okay, so this concept is very important to understand. We have monozygotic twinning, which basically has formed because of the primary embryo having split into two. Dizygotic twinning is because two ova were released and they were fertilized by two sperm, and hence two embryos, separate embryos, have formed. So monozygotic twins are genetically identical, and dizygotic twins are not genetically identical. Okay, so another important concept to understand is in chorionicity. Chorionicity basically means again the type of twinning. So what happens is in dizygotic twin, what was happening in dizygotic twin? Two separate ova were fertilized by two separate sperm and they formed two separate embryos. So remember, dizygotic twins have their own amnion and their own chorion. So they are diamniotic, dichorionic. So when they grow, this fetus will have its own amnion and its own chorion, and this fetus will have its own amnion and its own chorion. By chorion we mean placenta, by amnion we mean the amniotic sac. So each fetus will have its own amniotic sac and its own separate placenta. So it's called a diamniotic dichorionic twin. This is dizygotic twinning. But in monozygotic twinning, let's see what happens. Again, let's remember one ova was fertilized by a sperm and this forms an embryo and this splits into two. Okay, now depending on when this splitting happens, the chorionicity may change. Okay, so let's see. The first scenario is the splitting happens within 72 hours or the first 3 days. Then what happens? Then each embryo has completely split, so each will form its own amnion and its own chorion. So again we'll have diamniotic, dichorionic type of twinning. They're monozygotic, but they are diamniotic, dichorionic because splitting has occurred really early. The second scenario could be that splitting occurs between the 4th to the 8th day. So what happens? The embryos have split, okay, but the amniotic cavity has already formed. Okay, so another important feature when we talk about types of twinning is the chorionicity. Okay, so remember what was a dizygotic twin? A dizygotic twin was there are two ova being fertilized by two separate sperm and each forming a separate embryo. Now because they're forming their separate embryos being formed, each will have their own amniotic cavity and their own placenta. Okay, so this is the amnion, this is the chorion. So dizygotic twins are always diamniotic, dichorionic. That means they have their own amniotic cavity and their own placenta. Okay, what about monozygotic twins? So monozygotic twins, remember, they form because one ova was fertilized by the sperm and they form an embryo and the embryo splits to form two twins. Now depending on the time of splitting, okay, that's very important to understand, that will determine the chorionicity. So if the splitting occurs very early, within the first 3 days of fertilization, okay, the first 72 hours, what happens? Each embryo forms its own amnion, its own chorion, its own amnion, its own chorion. So they become diamniotic, dichorionic twins. Okay, so each embryo has split, it's formed its own amniotic cavity, its own chorion, and hence they form diamniotic, dichorionic twins. But what happens if the splitting occurs between the 4th to the 8th day? That is a little later on. So what happens? The chorion has already formed, okay, but each embryo has split and formed its own amniotic cavity. So this is called a monochorionic, one chorion, diamniotic type of twin. So the embryos have split, they form their amniotic cavity, but the chorion has already formed. Okay, so this is monochorionic diamniotic. The splitting happens later, between the 9th to the 12th day. What happens? The chorion has formed, the amnion has formed, and only the embryos split. So what is this? This is monochorionic, one single chorion, one monoamniotic, one single amnion. This type of fitting is called monochorionic, monoamniotic. There is no intervening membrane. Both the babies are lying in the same amniotic cavity. And the last type is when the splitting happens after the 13th day. What does this happen? The chorion has formed, the amnion has formed, and the fetus is also now quite formed, and when it splits, the splitting is incomplete. So what does this result in? This results in a conjoined twin. Okay, so these are the different types. And why is it important to understand this? Because the complications were a monochorionic twin. All these three types of twins are monochorionic. They have a single shared placenta. The incidence of complications are higher in monochorionic twins as compared to diamniotic, dichorionic twins. So understand this fact. This is very, very important to understand. Okay, so let's move further. So how do we determine this chorionicity? Of course, we will know only for sure the chorionicity after the baby delivers and we actually examine the placenta and see what is the type of chorionicity. But if we have an idea or if we can diagnose this earlier in pregnancy, we can be more vigilant. We can watch out for complications. If we know, yes, this is a monochorionic twin, we are more vigilant. We can anticipate complications beforehand and look for them beforehand only. So how do we determine chorionicity in the antenatal period? We determine it by ultrasound. Okay, and what do we see on the ultrasound? We see the number of placentas, we see the presence and the thickness of the intervening membrane, and we see the, of course we don't reveal this, okay, because our laws do not allow us to. But this is another way we can see. If you see that there are two separate sexes, one is a boy, one is a girl, then you're sure that it is a dizygotic twin. Okay, it cannot be a monozygotic twin. You're sure it's a dizygotic. But what the main way we see, is by seeing the presence and thickness of the intervening membrane. So let's talk about this point in a little bit more detail. Okay, so see this picture. Okay, so what is this? This is the placenta. Okay, can you see this here? This is the placenta, and this is this thin line here, you see, this is the intervening membrane. Okay, this is the intervening or intertwin membrane, and one fetus is here, one fetus is here. So you can make out that there are two amniotic cavities. Okay, but is there one or two placenta? That becomes difficult to make out. Okay, so this sign which we see here, can you see this sign? This looks like an inverted T sign, this sign here. Okay, can you see this sign here? This is an inverted T sign. So this is a sign made by the intervening intertwin membrane and the underlying placenta. And if it is an inverted T or a thin line like this, okay, this is basically significant. This means it is a monochorionic diamniotic type of twin. Why? Because there are only two layers of amnion in the intertwin membrane and a single chorion. Okay, so this membrane is thin because it has only two layers. You can see the blue lines. These are the two layers of the amnion. So this is a monochorionic diamniotic twin. Okay, as against this one, can you see this? Now you can see this a little bit more clearly. You can see the two separate fetuses, and can you see this intertwin membrane? Is this thicker or thinner than the earlier one? This is much thicker. Can you see how it's going like this? Okay, so this is called a twin peak sign. Okay, also called as a lambda sign. Okay, so this is called a twin peak sign, and it's called a lambda sign because this is how it appears. And this is what is seen in dichorionic diamniotic twins. Why is it thicker? Why is it forming this triangle sort of thing? Because the intertwin membrane has one amnion, one chorion, one amnion. So it is 4 layers. It is much thicker. So when do we do this ultrasound? It is best done between 12 to 14 weeks to determine the chorionicity. Alright, and it's important because once we diagnose MCDA twins, we are more vigilant. We know that there could be complications in this twin. Alright, also important to remember in an MCA-M8 twin, monochorionic monoamniotic is very easy to diagnose because there will be no intertwin membrane. This intertwin membrane is seen only in MCDA twins and DCDA twins. In monochorionic monoamniotic, both the fetuses are in the same amniotic cavity. There is nothing separating the fetuses. So this is a video of the twin peak sign, okay, or the lambda sign. Try to appreciate the intertwin membrane, and you can see that it is quite thick, and you can see the indentation of the chorion entering the intertwin membrane, which is making it appear as a twin peak sign. So let's have a look at the video. So you can see nicely, this is the two fetuses, one here, and see the intertwin membrane right in the middle. You can see it's quite thick, and the beginning of it is looking like a triangle or a lambda sign. That's why it's called a twin peak sign. Alright, now we also have a video of a triplet pregnancy. So I thought I'd show you how a triplet pregnancy would look like on the ultrasound. Okay, see, you can see this. You can see 3 gestational sacs. Okay, and you can see 3 separate fetuses in the sacs, and it's quite interesting to see a triplet pregnancy. This patient was around 10 weeks pregnant when she came to us. Okay, so let's quickly recap the discussion of the etiology and chorionicity of twin pregnancy. So the incidence of twin pregnancy, as I said, is determined by Helen's rule, which is 1 in 80 to the power n minus 1, where n is the number of fetuses. But of course the incidence is increasing because mainly of artificial reproductive techniques. In fact, the incidence of dizygotic twinning is increasing. The incidence of monozygotic twinning is relatively the same. Okay, what are the risk factors for twin pregnancy? Okay, we've already discussed this. Let's quickly recap. What are the risk factors? Increased age, increased parity, heredity factors, race is important, and very important, artificial reproductive techniques, even ovulation induction or IVF, both can increase the incidence of twin pregnancy. What are the types of twins? We have dizygotic and we have monozygotic twins. And what is a dizygotic twin? Dizygotic twin is formed by fertilization of 2 separate ova by 2 sperm forming 2 embryos. What is monozygotic twin? Is when 1 embryo is formed and this splits into 2, and this is called a monozygotic twin. And it's very important to understand, that monozygotic twins can be of different chorionicity depending on the time of splitting. So if it splits very early on, it forms diamniotic dichorionic twins. If the splitting occurs between the 4th and the 8th day, it forms monochorionic diamniotic twins. If the splitting occurs even later till the 12th day, it forms monochorionic monoamniotic twins. And if the splitting occurs after the 13th day, it forms conjoined twins. Dizygotic twins are always diamniotic dichorionic. They have their own amnion and their own placenta. Okay, important to remember, monochorionic twins are at an increased incidence of complications, and hence it's important to diagnose this early on ultrasound. On ultrasound, what do we see? We see a twin peak sign or a lambda sign. This is seen in diamniotic dichorionic twins. And we see a inverted T or a reverse T sign in monochorionic diamniotic twins. In monochorionic monoamniotic twins, there will not be any intertwin membrane. So that's about the chorionicity of twins. Let's quickly do some MCQs. During twin gestation, if division takes place on the 7th day, what would be the result? Would it be diamniotic dichorionic, diamniotic monochorionic, monoamniotic monochorionic, or conjoined twins? So remember, the first 3 days, if splitting happens, DCDA twins. But if splitting happens between the 4th and the 8th day, the chorion has already formed, but the amnion gets separated. So we have diamniotic monochorionic twins. A 24-year-old primigravida is diagnosed to have a twin pregnancy on her first trimester scan. The following image is seen. What is the chorionicity? So you can see this. This is an inverted T or a reverse T sign. Where is it seen? It's seen in monochorionic diamniotic type of twin. So this is the correct answer. All help in determining the type of twins except examining the placenta post-delivery, yes. The number of placenta, yes. The presence and thickness of inter-twin membrane on the ultrasound, yes. Doppler of the umbilical arteries, no. No, Doppler will not help us determine the type of twin. Doppler will tell us whether the blood flow to the fetus is alright or is compromised. Okay, so the reference for this is our standard book. Okay, and it's a very interesting topic. We will continue with this further in part 2 and part 3.
Docemy.